I'm kind of skipping through the book here, essentially, or the concepts that are in the book, The Hidden History of American Healthcare, Why Sickness Bankrupts You and Makes Others Insanely Rich. And I wanted to talk about how can we get to a single-payer healthcare system in the United States. And there's a couple strategies I outline in the book. One is, let's just buy all the health insurance companies. They're worth about $1 trillion, their market capitalization. That's the first year of Trump's tax cuts. It's an amount of money that, is not that big a deal for the federal government. Just buy them. That's one possibility. I doubt that's going to happen, but, I wanted to lay it out as an idea. But the other is how Canada got health care. Tommy Douglas was a politician from Saskatchewan who went off to be a federal politician, what we might call a member of Congress. He was a member of the Canadian Parliament for years, back in the 50s, where he was advocating for single-payer health care without any success at the federal level. So finally, he just gave up. He said, screw this. He went back to Saskatchewan, which is, it's a fairly large province, what we would call a state. But like Vermont, it has a fairly small population. So you can really do retail politics there. When I lived in Vermont, people used to joke about how everybody in Vermont has shaken Bernie's hand at least 3 times, because he just does retail politics constantly. He's like the Energizer Bunny. And it's probably up to 10 times now. Well, Tommy Douglas went back to Saskatchewan and did that. He did retail politics. He just traveled all over Saskatchewan and got elected premier, governor, and pushed through and passed and put into place a single-payer healthcare system. And it was so successful at giving everybody coverage at a really low cost and really working well that within a year or so, the provinces around them were, Ontario, British Columbia, they were like, whoa, this is cool. We want this. And within a decade, actually, I believe it was less than a decade, it had spread all the way across Canada. Every Canadian province wanted to have what Saskatchewan had, and they all cloned it, although they did it in different ways. Some provinces included vision, some included mental health, some included hearing aids. I mean, it varies from province to province, and there's different prices from province to province. And then the federal government stepped in and created a kind of backup funding system so that if somebody from Saskatchewan got sick while they were visiting Ontario, the Ontario system would provide for their care and then could bill the Saskatchewan system via the federal government. So, it's worked well, and it's based in the states. We can do the same thing here in the United States. Vermont already passed single-payer health care and tried to put it into place. California, too. Both of them were stopped dead in their tracks by the fact that if a state goes single-payer, they lose access to Medicare and Medicaid payments. Because back in the 60s, Lyndon Johnson built into Medicare and Medicaid because he was concerned that the southern states would take the money and then refuse to use it to pay for black people's health. So they put into these 2 programs basically a provision that says if the states try to to take this money and use it other than exactly the way this law provides, they can't have the money. So what we need to be doing is contacting our legislators, our 2 senators and our member of Congress, and telling them in plain, straightforward, simple language, please vote for Medicare and Medicaid waivers for the states so that individual states can put into place single-payer systems. That's how you say it. And they'll all understand exactly what you're talking about. The actual, pitch would involve acronyms and ERISA and all this kind of complicated stuff. But if you just say, please vote for these waivers. Now, the health insurance companies have been fighting these things tooth and nail. Congress has repeatedly proposed them. Democrats in Congress have repeatedly proposed these waivers. Bernie has been at the forefront of this, but, it's right across the board. Many Democrats are supportive of this. But the Republicans and a few of the Democrats who are deeply in the pockets of the health insurance industry have been fighting them. If we do that, then overnight, California and Vermont will have single-payer health care. And you can bet your bottom dollar that within a year or 3 or 4 or 5, pretty much every other state in the United States, maybe excluding the red states where they haven't even expanded Medicaid, but pretty much every other state will have single-payer health care. And the pressure will be on the politicians of every single state in the United States to do what these other states have done. So this is a very straightforward way that we can bring about health care for everybody in the United States and just join the rest of the world. Canada has better healthcare outcomes than the United States. Their people live longer than the United States. And the only reason is, or the largest reason, inequality is part of it, but the largest reason is that everybody in Canada has health insurance. And everybody in the United States doesn't. We have tens of millions of people who have no health insurance, and we have over 200 million Americans who are essentially underinsured, who would go broke if they got sick, seriously sick. So we got to fix this. And I wrote the book as kind of a how-to manual on how to do it. The Hidden History of American Healthcare: Why Sickness Bankrupts You and Makes Others Rich.